Hi there, welcome back to the channel. It's nice to see you here again. Today, one more Q&A video, real quick one about eyebrows. So let's go ahead and play the question and I'll follow with the answer. Okay, here we go. Here's the question.
Hi, Dr. Barusco. I'm Camila. I work here at Vism Salon. I have my client here today. She doesn't have many eyebrow hairs, and I was wondering what you can do if you do any eyebrow implants. I heard that you have some kind of services that could help with that. I was wondering how long it lasts, what the procedure is like, and what the clients should expect when getting this service done. Thank you very much.
Thanks, Camila, for the question. That is very, very commonly asked here at the office. We see a lot of patients that are looking for eyebrow restoration. So before we talk about the techniques and everything like that, I want to keep this nice and short. But people lose eyebrow hairs for many reasons. Most commonly, they pluck when they were young and they want the eyebrows real nice and thin. And then now that the fuller eyebrows are back in vogue, right? They want it to grow and they can't because the hairs eventually quit after you pluck it for so many years. Sometimes they laser, sometimes they wax them, and now they want to grow the hair back and they don't come back. Sometimes people lose eyebrows because they had accidents or surgeries and they had scars there and lost part of it too. We can also help with that. And a lot of times aging causes eyebrow loss as well. Thyroid disease can cause eyebrow loss. So a lot of times as we get older, you notice that the outside, the tail as we call, the head is here, the tail of the eyebrows, they get really thin. So a lot of times patients will come to us and they want to recover or to reconstruct that so they can better frame their eyes and frame their face. The eyebrows are very important for our expression. So if we don't have them, people start to pencil them in, and penciling is great. In the old days, they used to tattoo. And I see patients with tattoos before that were done before as well. And nowadays they do the microblading, which is a much more delicate way of putting tattoo pigment into the skin to mimic the eyebrow hairs. Those are okay techniques based on what we had available or we have available now. But the problem with the tattoo, the penciling or the microblading is that while they'll give you the shape, they're not going to give you the depth, right? So a transplant, when you actually put physical hairs in there that'll grow, will give you that depth perception, which is much better. And so a lot of times people combine the microblading, for example, and the transplant. So the microblading will create that background darkness, which will make it look fuller, and the transplants will create that dimension to it. So transplants work really well. And like I said, it can be we can do transplants on scarred eyebrows and things like that too. The technique is fairly simple for the patient. Or you do it under local anesthesia. It's a fairly simple and quick procedure for you. We harvest the donor hairs usually from the temporal areas. We can do it with the strip technique or FUT, or we can do it with the FUE technique, whichever way it's best for you in your situation. The important thing with eyebrows is not a simple surgery for the surgeon and for the team. It requires experience and it requires a certain technique. Why? Because the hairs in the brow, they grow in a certain way, in a certain direction, in a certain angle against the skin. So it's important for me as a surgeon to mimic those natural angles so that the hair can grow naturally. And this is a great example, I think, a picture that I took the other day from a patient. You can see here the incisions that I made, and these incisions, you can only see the top, but they are like little holes really that I made with a needle. And here we have a graft being inserted in one of these incisions. So you can see how the angle sort of matches the angle of the hair, right, exiting the the skin. And you can see here that graft has a little bit of a hair shaft that I left so I can check the direction of the curl. And you can see how it's going to flow really well with the hair that's there. So that's the goal with the eyebrow. Of course, like anything else, even the goal with the transplants too, is a natural result. So if it's done correctly, it's going to look great, and you're going to have fuller, thicker, more voluminous eyebrows and better frame to your face and your eyes. So if you want to know more about this, if you or anybody you know think you can benefit from this procedure, talk to us. Consultations are free as always. We can do them via internet all over the place, or we can do it here in our office in Port Orange. I can go over the technique in more details for you. Recovery, which is a question we get a lot of, before I forget, it's about a week. We're gonna have like little scabs in there, and then they'll fall out and the hairs will start growing back. So call us if you want to talk about this or any other hair loss issues, and we can talk to you via consultation. If you like these videos that we're putting out, give us a like on the like button below. Subscribe to the channel so you can get the content. We would really appreciate that. Okay? I'll leave you here for right now. I'll see you next time.